My name is Dr. Libby. I am primary therapist at Alternative to Med Center in Sedona, Arizona. I'm here to answer some questions that our viewers have had regarding trauma, what it is, how we treat it, and how we can most support people coming in with trauma. So we'll start with what is trauma. I have learned over the years of being a therapist that trauma is actually self-defined. There is a broad umbrella in terms of things like post-traumatic stress disorder, but individual trauma is really a matter of perception based on what the person's experienced and how those around them treated their experiences. First of all, trauma is not often a singular event. It can happen in a singular event if that event is particularly traumatizing. For example, a car accident, abuse, physical or sexual abuse, emotional abuse, anything that could cause a shock to mind, body, and spirit is considered to be trauma. But again, it's how a person defines it. I've known people who have gone through horrific situations and they're able to be what we call resilient. And resiliency is really where we want you to help you end up finding in terms of peace and overcoming your trauma. The most common trauma is repetitive trauma. And actually not the most common, but the most devastating. And so repetitive trauma is something, for example, bullying at school. We'll take that. When children go to school and they're every day continually bullied, that is a repetitive trauma that over time is going to take its toll on mind, body, and spirit. And it's something that down the road can lead to anxiety, depression, substance use, suicide. And so we really want to be aware of people who have gone through repetitive trauma versus, say, singular trauma, because those are the people that most often go into what we call fight, fright, freeze mode. And so the fight is kind of this ability to say, I'm just going to fight this off, I'm going to fight the bullies. And then fright is just being completely afraid. And then freeze is not knowing what to do or what to say in the moment. So the body can respond in myriad ways. And one of them is obviously through the central nervous system, where we're completely, for lack of a better technical term, charged up. And so we're kind of always on the edge. And this living on the edge, or in fear of our lives, or in fear of being bullied, using my example, is something that long-term really wreaks havoc on the body. So some of the things that people do who've experienced trauma, they go and seek out medications, benzodiazepines, for example, to treat their trauma and treat their anxiety. There are many ways for people to sedate themselves and help feel better about whatever it is they've gone through. The symptoms of trauma, I think I just mentioned quite a few of them. I mean, they really do range. In terms of treating trauma, the symptoms become almost secondary to the trauma in that the treatment, again, is based on the experience of the trauma, the repetition of trauma, the person's perception of the trauma, what they've done to help treat that trauma, and then eventually get them back into a space where they can be resilient. So again, using the bullying incident, child goes to school, gets bullied, and some kids just don't pay any attention to it. And so they have this resilience. Imagine a rubber band, if you will, that other children might go to school and they're bullied and that rubber band stretches. And then they go home and it comes back to normal. Then they go back to school. So imagine this, and this can be in any situation, any traumatic situation as someone defines it to be. So that rubber band often over in a repetitive situation stays tight. And that's where trauma really can cause havoc in mind, body, spirit. When that rubber band does not go back to resiliency, then the person is really in danger of physical ailments, definitely emotional and spiritual components that make life not so pleasant. So we want to get the person back to a sense of resiliency. We want to bring them back to Okay, here's where you are. You are on edge all the time, looking over your shoulder. An example might be a veteran or even somebody something happened with a loud bang, and so the person will hear a loud noise and immediately, jump, and that rubber band just gets tight. So we want them to just get to where they come into the center and that rubber band relaxes, and then they relax and they learn how to work past the trauma. And there are a lot of different ways to do this. Hypnotherapy is another form of therapy which helps clients to almost get into a state of mindfulness, and that's just being present now. Because with trauma, people tend to live in the trauma. So we want to pull them out, put them in a state of mindfulness, and hypnotherapy helps with that, and then just help them to feel safe. That's the main objective. The trauma will always be there. We can't really erase what's happened to people. But in the end, using positive psychotherapy is, how did you learn? What did you learn from that experience? How has it made you grow? Oftentimes people will say, I'm kind of grateful that I went through that, as traumatic as it was. A good example might be somebody who's been severely invalidated in their life. They've been psychologically abused, physically abused, and they go into counseling, or they go into social work, or maybe they become a doctor. So their history, their past helped create the person that they are, so they in turn turn around and help other people. So trauma, even though it has a very negative connotation to it, the end result can actually be quite positive. And that's where we want people to be. We want to loosen that rubber band and show them a different way of looking at trauma, which some people have normally, and other people it just takes a lot of different modalities, different therapies to help them get to that point. I hope this answered your question on trauma, and thank you so much for your questions. And if you or a loved one or anyone that you know is experiencing trauma and you think they might benefit from being at Alternative to Med Center, please have them check out our website at alternativetomeds.com. Thank you so much.
Thank you for watching. Don't forget to subscribe to our channel. For information about Alternative to Med Center, give us a call at 888-984-9667.